Hi, I'm Dr. Giardina, licensed psychologist practicing in Coral Gables, Florida. I want to let you know a little bit about who I am and what I do. It's tricky, the industry I'm in, because you can't really sample the product until you're in the room with me. I'm not allowed to videotape my sessions. I can't tell you who my current patients are. So this is a hard product to sell. Let me try to explain a little bit better about who I am and what a therapy session with me is like. First off, I practice what I call holistic psychotherapy. I try to see the whole person using what I call the Health 360 assessment. We look at not just your mental well-being, but physical, social, spiritual, sexual, financial, occupational. I want to know all aspects of you, and I may not be able to fix all those aspects. I am specialized only in the mental, but it's important that we factor them all in and get you to the right providers, give you the right referrals, understand all the intertwined parts. I work with folks over age 18, no children. I work primarily with women and couples. That is my focus, but that's not the only people I see. I see a little bit of everybody. I have specialties in grief and in health psychology. So anybody with any health issues, adjustment to illness, dealing with family members' illness, I deal a lot with that. And then subsequently, if there is a loss, if someone passes away, I can help you through that. Therapy with me is different. Every therapist has their own style. What you'll find with me is that I try to come across as me, real, genuine. I have something of a therapist's voice, but I've learned over the years to let it go. I was trained originally in the old school Freudian style with lots of I've tried to let that go. What I want to give you is an interpersonal experience, just two people in a room. There's going to be times where I'll even crack jokes. I will share personal stories at times. I want you to see that it's you and me together. And I bring a level of knowledge and experience and expertise, but we're two people having a conversation. It shouldn't feel awkward. It shouldn't feel too doctory. But my knowledge is doctory. Another thing that you're going to get if you see me is I give homework. I think it's important that people don't just have a nice conversation. Whether you cry or laugh with me, you'll feel better at the end of the session. But to make real change, and I'm invested in true behavior change, I give homework because I want to see that you are taking steps in between our sessions, that your life is changing, not just your feelings. To that end, I work from something of a medical triage model, meaning if I were an emergency room physician and you came in with bleeding, we have to stop the bleeding before we ask, why are you bleeding? And so if you come to me, I'm going to teach you skills and tools and techniques to manage your distress on the day-to-day. And once we get a nice solid foundation of that, then I ask, where did this start? Where does this come from? Then we go into the why. What you'll get with me is also no answers. I don't tell you how to live your life. I don't tell you yes or no answers. We can talk about anything. I have no judgment. I don't care who you sleep with or who you vote for. You can bring me anything, but I don't know the right answer, because maybe there's not one right answer, but we work together to find the best you or the best path for you, working with who you are and what you've got. What are your values? What are your skills? What are your needs? What are your fears? I should also mention, as I said, I work with couples, and in my couples work, we focus on a couple of things, pun not intended. Communication is key. It is so essential to understand the different genders, the different ages, where's the mismatch in the members of the couple. I try to help translate that. We work on connection. How did you first get together? What keeps you together? We need to understand what we're fighting for. And ultimately, I try to give a forum of a safe space for people to be honest, to say the thing that's been on someone's mind or been coming between you, and it just hasn't been put out there. It can be scary, it can be overwhelming, but once it's out there, then we know what we're dealing with. And I'm sure there's a lot more that I could tell you, but it's hard to sum it up until you sample the product. I do offer brief phone calls if you want to speak to me directly before you schedule a session. And I remind all my patients when you sit down with me in a first session that this is sort of like dating, that you need to go on a few dates and see how it feels, and therapy may be exactly what you need, but I may not be the right fit for you, and that's okay. I have plenty of other colleagues and clinicians in my office. We can make sure you get the right person. But just to give you a little sample today, this is kind of how I work and who I am. I look forward to speaking with you soon. Be well.